pretty much exposed to a lot of antimicrobials. It's becoming increasingly resistant to both amoxicillin and clarithromycin. These are usually given for 10 to 14 days. Bismuth compounds are also recommended in allopathic treatment, and I know in naturopathic treatment that bismuth is used also. It doesn't have to be sticky sweet Pepto-Bismol either in some kind of pink compound, but there are other bismuth compounds that can be made. Bismuth does inhibit H. pylori growth, and it also increases mucosal secretions. So it has both effects, and it also has a coating effect. There's some interesting new research on cabbage juice, which has been a traditional remedy. It's been demonstrated to work in an animal model at this time of ulcers. There is yet to be the human clinical trial that's really definitive for cabbage juice. If somebody wants to do that, I really would be interested in participating in that. Some other interesting research is that isocyanates from cruciferous vegetables have been shown to inhibit H. pylori, and the urease also that's produced. And the urease is key here. The urease breaks down urea, and it makes for a more basic environment for the H. pylori to grow, and it's also the basis for the urease test. Yeah, so most H. pylori carriers do have gastritis. I think that's probably the case for H. pylori in the stomach. And what I'm disagreeing a little bit is it's probably not as clear cut in the duodenum. So yeah, agree with both of you there. At least that's what the data is. This is a nice little chart here. I like using this. It's not quite accurate, but it gives a basic idea here. Just a reminder of what proton pump inhibitors do. They act here. So this is the parietal cell and the lumen of the stomach. And so proton pumps actually, this is putting the acid out from the parietal cell into the stomach. And at this point, the stomach's going to be kind of coated a little bit here too. And some of the older drugs like H2 blockers, so histamine stimulated this process and activated a kinase that activated the proton pump. The new proton pump inhibitors, such as omeprazole and esomeprazole and some of the others, these drugs directly activate this proton pump, and they block acid secretion more strongly than the original H2 blockers, but the H2 blockers also worked, and some of them also had side effects. What I want to mention here is that prostaglandins actually bind to a receptor that activates an inhibitory subunit. So prostaglandins inhibit acid secretion. However, if you block prostaglandins, which NSAIDs do, you block the inhibition, and therefore you get more acid secretion. So NSAIDs do a number of things that are going to promote ulcers, including increasing acid and decreasing blood flow. Some of the other signals that are typically seen, so gastrin, you can get this increase from stomach filling, from duodenal filling can turn it off a little bit, and reflex action. And then acetylcholine, so this is overall parasympathetic, rest and digest, GI contractions here also turn on. Both of those through a calcium-activated pathway turn on acid secretion too. So that's just a reminder of the basic physiology of what's going on. A little bit about PPIs. It's important to address them because a lot of patients are going to be using them. They're available, most of them over the counter, and people use them like candy a little bit. They're recommended for use a lot, and they have some major adverse effects. So let's go through some of these. So esomeprazole is Nexium, omeprazole is Zegerid. Some of their major side effects are headaches and GI disturbances. We'll get to some of the other things coming up in a minute. Lansoprazole, this is Prevacid, again, mainly GI effects in the clinical studies. And then pantoprazole, Protonix, this is headaches and GI effects. 1 and 2, so esomeprazole and omeprazole. So this is just a inactive component that's converted to active. It works a little better than omeprazole, but they're the same. And 1 and 2 are available over the counter. So a couple of common problems between all of them. The bone fracture problem. There's a fair amount of data showing that there's an increase in bone fractures. There is some dispute about whether or not it's due to decreased calcium absorption, which would make some sense given the fact that you're reducing acid secretion. But some of the data indicates it's not necessarily decreased calcium absorption, that there may be other causes involved, including